So, Dr. S, I'd like you to look to the future a little bit for this last question. When you think about the future of pediatric mental health care, where do you see all of this heading?
So we're really at the beginning of the shift from a very reactive and episodic care model to something that's much more preventative and continuous, right, in pediatric emotional health. And I think for most of us, that makes sense, right? So if we have a child, we see them struggle for months or years before a family reaches a crisis point, and then they look for help. Right. At that point where, as a physician, I'm intervening when a family and a child is already significantly impaired. There are a lot of difficult patterns, both on the parent side and on the child side, that are entrenched, that have to be undone, will require significant therapy. It's kind of like undoing a lot of bad habits that built up, not because anybody did anything wrong, but because they were trying to survive through a difficult time, right? And that is a difficult thing to have to dig yourself out of, right? So instead, if we move towards a future, right, where the physiological monitoring becomes a routine option in pediatric care, right, where you say, oh, I'm not totally sure if this is good or bad, but maybe I can get that band for my kid and we can monitor and I'll get a better idea and I'll get some help in helping them manage their tantrums, manage their episodes of dysregulation. Now we can catch it early. We can identify when interventions are effective, and we can start to close that gap between something seems really hard and we're finally getting support from, and that used to take years or months to get from that point to get to actual support. Mm-hmm. And now we should be able to get there within weeks, right? I think there's this amazing push that the industry is generally trying to make. They're trying, the healthcare industry is consciously trying to shift towards prevention in healthcare instead of what we call sick care, right? I don't think we're doing a fantastic job. Most of our health insurance is still very much based off of sick care, but I think the conversations are happening more, and I really appreciate that. We are building a lot of tools to predict the next crisis and prevent it, which I think is great. And we are definitely using technology and AI to take that to the next level and use data to do that. But what I really wish we did more of was use technology and AI to figure out what helps our children do well, to figure out what makes our families happy, to figure out what actually gives us joy and meaning and purpose in our days, right? We spend a lot of time trying to prevent bad instead of using technology, using AI to make good, right? The more we use these tools to see what contributes to good days, faster resolution, the more we move from let's stop the bad thing to let's create conditions for the good thing. That is optimization and not just prediction. And I know it's a little subtle, but for me, it's also this mindset change that changes everything for families, right? We're not trying to stop kids from behaving badly. We're trying to give families tools to be happier, fundamentally just happier, right? And so I really want, listeners to think about that and think about, well, what are the outcomes that matter to me? What do I wish Maxis could help me with? I think we want to change the way we think about, well, I don't just want fewer outbursts from my kid, but what I want are more dinners, more family dinners where we share stories, not just better sleep, but my kid loves going to sleep now. They want to have shared time reading a story before we go to bed, right? And so I think that's what I hope we can work on together.
It's just such exciting times when it's all coming together. So I really appreciate you spending time with us today, Dr. S. Thank you so much for all of your insight and your compassion. Your energy clearly comes through, and it's really exciting to hear what's happening at Maxis Health. For our listeners, if you want to learn more, you can go to maxishealth.com. And the Ori app that we've been talking about is available on both the Google Play Store and the App Store for download. So thank you again for joining us, and have a wonderful day.